The head of the Africa Centres for Disease Control and Prevention has warned Western countries there could be serious consequences if they fail to help the continent with its latest Ebola outbreak. There's been more than 80 deaths reported in the Democratic Republic of Congo, with nearly 300 suspected cases across the country and in Uganda. The World Health Organization has declared the outbreak a public health emergency of international concern, as it poses a risk of spreading to neighbouring countries. The outbreak has been caused by a rare strain of the disease which has no approved vaccine. The DRC's health minister is urging residents with symptoms to seek treatment quickly.
On sait que les hôpitaux sont déjà sous tension.
We know the hospitals are already under strain because of the patients. We have 59 patients who are actively being treated at the moment. The sooner we take the patient in for care, the sooner we treat them, the sooner we will stop the movement, what we call the spread of the virus. This is not a mystical disease. Make yourself known so you can be taken care of, and so we can prevent the disease from spreading.
Well, let's get more on this. Professor Raina MacIntyre is an epidemiologist and the head of the biosecurity program in the Kirby Institute of the University of New South Wales. Professor MacIntyre, thank you for joining us. This outbreak has been declared a public health emergency of international concern by the WHO. It looks to have been spreading for weeks. Just how deadly is Ebola and how easily is it spread?
So Ebola is a very serious infection. This particular strain of Ebola is not the most severe, but it seems to be killing about 30% of people who've got infected so far. There's probably more than 300 cases. And it was identified very suddenly, or publicly anyway, last Friday, when it's clearly been going on for, weeks, maybe even more than a month before that time, because to grow to be 200 to 300 cases, it's got to have been going on for a while. So it took the whole world by surprise. It spreads relatively easily through close contact, particularly with bodily fluids. But there's other ways it can spread, like from mother to baby, mother to fetus in utero. And there's been some examples of transmission without close contact as well. So, but the predominant mode is contact with blood and bodily fluids.
You mentioned that surprise there. I mean, this has been taking place in a conflict-torn part of the world and detected relatively late, you would say. What are the concerns with that?
Well, the concerns are it's already spread to Uganda. So, that part of DRC is bordering South Sudan and Uganda and quite close to Rwanda as well. So we'd be worried about other local spread happening in the continent, in the African continent. And if it gets much bigger, then we'd be worried about international spread outside of the African continent. And we did see that in 2014, which was an enormous epidemic of Ebola in West Africa at that time, of about 28,000 cases. And we did see cases popping up in emergency departments around the world. The DRC did have a very big epidemic with over 3,000 cases in 2018, and that was the Zaire strain, which is more serious. So it is a country that's experienced Ebola epidemics before, which means that there is knowledge and expertise to contain it.
And I mean, how is it treated, and moving forward, how is it prevented?
There is no drug or vaccine for this particular strain of Ebola. There are drugs for the Zaire strain. It's prevented by infection control measures, such as wearing gloves, if you're respiratory protection, aprons, boots, etc. If you're in contact with a patient with Ebola, there's very strict infection control protocols for that. But often the transmission might occur in other settings, like in a funeral, for example. And in many African countries, the funeral rituals involve touching the body, bathing the body, etc. So, and there has been spread associated with funerals. And then healthcare workers are at high risk. There is an increased risk of health workers developing Ebola after caring for patients, often when the diagnosis isn't made and they're not fully protected because they're not wearing the correct PPE. And then in families, in households as well, you can get transmission.